10 things not to say to your patient by a behavioral health provider.
You need to...
Well, when you say that, it makes me feel minimized and marginalized, as if you somehow are all-knowing. How about if you had said, would there be any value in, or have you considered...
You should have...
Not helpful. We're here now and I did what I did. How about saying, how do you feel about the choice you made?
I know how you feel.
You have no idea how I feel, and pretending that you do is disingenuous. Maybe if you had said, there's no way for me to know how you really feel, but I really want to understand how it is for you.
Everything will be all right.
Maybe things will be okay, but there's no way you can know that. Instead of saying that, maybe you could try, there's no way to know how this will go, but we can talk about possible scenarios if that would be helpful.
Wow, that is terrible.
I already knew it wasn't good. There's no need to make it worse by telling me that. Maybe you could try, how was that for you?
Well, this is what happened to me.
I don't care what happened to you, and I'm not paying you to provide a place to tell your stories. The fact of the matter is there are sometimes, very rarely, situations where a very small bit of self-disclosure is helpful and possibly even therapeutic, but generally what happened to the therapist is not even relevant or helpful in any way.
You look good. Did you lose weight?
So, are you telling me I didn't look good prior to losing weight? My body has nothing to do with our work unless I tell you that it does. Instead, you might try saying, it's been a joy to watch you grow emotionally, and I'm honored that you're allowing me to share this journey with you.
You really did that?
Yes, and your shock and judgment don't change that fact. What about saying, how do you feel about having done, said, or thought that?
If I were you, I would have...
You're not me. Maybe you could try saying, how do you feel about that decision?
That is crazy.
Crazy is a loaded, judgmental word. Don't use it in my presence. Instead of that, maybe you could say, that sounds like an intense experience. How was that for you? Obviously, all of us have said things to patients in interactions that we wish we hadn't, and that's okay. If you come from a place of compassion and empathy and caring about the people you work with, then you're probably doing just fine. This is The Black Bag. Thanks for watching, and make sure to click the like or subscribe button below.